Welcome to the Age is Irrelevant podcast with your host, Helen Fritsch. Helen is a 60-plus lifelong competitive athlete, flight attendant, published fitness model, writer, IFBB bodybuilding pro, and certified wine specialist who believes that your age is irrelevant to pursue goals, dreams, and desires. Are you a woman in her 40s, 50s, 60s, and beyond who still has a burning desire to pursue a dream or a passion? Are you thinking about starting a new chapter in your life, but you're hesitant, thinking that you might be too old or just don't know where to begin? The Age is Irrelevant podcast is a podcast devoted to women who want to defy the odds, smash barriers, and redefine happiness and success after 40. It's time to make a difference. There is no need to dread blowing out that added birthday candle every year. A new movement is slowly taking momentum, where being over the hill just isn't relevant anymore. Age labels are being thrown out the window, and women are rediscovering the strength within themselves to make a difference, not only within their own lives, but also touching and inspiring the lives of other women. Join Helen as she and her guests discuss all aspects of aging after 40 and how to make the aging process and those twilight years more rewarding, exciting, and fun.
Hello, and welcome to the Age is Irrelevant podcast. I'm your host, Helen Fritsch, and this is episode 101. Well, grab a pen and a pad of paper because this is another episode that you're going to want to take notes on. I am speaking today with 51-year-old Dr. Suzanne Ferree. Now, Dr. Ferree is a double board certified doctor in family medicine, anti-aging, and regenerative medicine. She's a peptide expert and author. And today we are specifically discussing the world of peptides. There is so much value and so many benefits of peptides, yet a lot of people don't know about peptides. We discuss what are peptides? What do peptides do? Are they safe? How do you administer them? Do they have any side effects? How quickly do they work? How long before we see results? And then we get into specifics, talking about certain peptides for losing weight, healing, injury, improving skin, longevity, cognitive function, sleep, and libido. A great episode that is going to be very valuable to your wellness box. I can't wait to share all this information with you. Very, very informative. I was taking notes as fast as she was talking. I hope you enjoy the conversation, and here we go. Hi, Dr. Suzanne. Welcome to the show.
Hi, I'm so glad to be here.
I am so thrilled to be here, for you to be here also. And what I'm really thrilled is that this episode, I'm like a little kid in like a candy store, because literally what we will be talking about is like candy. For my listeners, I am talking to Dr. Suzanne Ferree Turner. Now, Dr. Suzanne is a double board certified physician in family medicine, anti-aging, and regenerative medicine, author, peptide specialist, and expert. Her trailblazing mission is to unlock the power of peptides to enhance human health. And as the founder of Vine Medical Associates, she takes a holistic approach to healthcare and specializes in cellular longevity and performance medicine. All the things that we love.
Yes, absolutely.
And so I always like to ask my guests just to talk about where you were born and some part of your childhood growing up, because I just find that really interesting how my guests have maneuvered their way to where they are today.
Right. So I was born in upstate New York. I don't remember it. I was about 3 when I left. So my family all moved to Virginia, and I studied biology, all the things at regular school, and then always wanted to be the president of the United States or an English professor.
Oh, wow.
So this came about a little bit backward way. When I went to William & Mary, and they required us to do an exam before we took our basic English course. And the results of that English course would place you where you would go. And the night before the English course, a good friend of mine was killed in a car accident. So I, instead of doing well on the English course, which I should have, I did not do well on that. And so I decided that wasn't going to be my course because they put me at the lowest level English class. And I decided to go towards biology and met a really terrific mentor who shepherded me through a lot of that time, and some other mentors along the way, a couple of ex-Army doctors who were orthopedic surgeons. And I worked with them over the summertime and just really fell in love with medicine. So the first patient we had was this woman who owned an apple orchard in Virginia. There's a lot of apple orchards. And so she had not been able to climb her apple trees. She was in her 70s. And she came to the clinic and we did some injections and she didn't recover. And then we took her to the operating room and replaced her knees. And I think it was just one knee. And she was able to climb her apple trees about 10 days later.
Wow.
So pretty impressive outcome. And I was like, wow, if I can help people get back to things they love like that, what an amazing gift this career will be. And so that's what I wanted to do from the very beginning. It's interesting. I'm just now putting all that together as you're asking me this question. And so, our little tagline is helping world changers get back to changing the world. And that's what we do. Even if your world changing is being a mom, or it's being a flight attendant, or it's being whatever it is, you're changing the world in the area where you are impacting people. And we want you to be able to get back and be doing the things that you love.
That's fantastic. And so after you got out of school, what happened next?
So I went to medical school. I went to Eastern Virginia Medical School in Norfolk, and then moved down to Atlanta and did my residency down in Atlanta. I thought I wanted to be a surgeon. And so I did a year of general surgery, and that was traumatic in many ways. Instruments thrown at me, all the things that you've heard about in medical school dramas. That's what happened, not sleeping for hours and hours. This is before the residency hours restrictions. And so there were weeks and weeks that I barely slept. It was pretty amazing. You learn a whole lot about yourself and about other people and about how the world works when you're not sleeping consistently for a long time. So anyway, that happened. And then, and I loved school. And then I went into the Navy because I was very debt averse. So I went to the Navy, and the Navy paid for medical school. And so I owed them time back. And that was really terrific. I learned a little more attention to detail. I learned how to help people not only in their physical lives, but also in their social lives. So things were happening in people's, you are in leadership position when you're in the military. So you not only are practicing whatever your job is, but you're also leading the people who report to you. And so helping people get to their best self that way also happens. So I would say to some of the enlisted guys, hey, when are you going to take your SATs? Because I think you're really smart and you shouldn't stop at this level of education. You need to move on. And they might not have ever had anyone encourage them in that way before. So it was great to have that influence over some people's lives. Then I started practicing regular allopathic medicine, thinking I was going to, allopathic is what most doctors practice, thinking I was going to work for Kaiser and be an employee the rest of my life and punch a clock at 8 o'clock and leave at 6 o'clock and let them tell me what medicines to prescribe and what x-rays to order and all of that. And then I read the book called Rich Dad, Poor Dad. Did you ever read that book?
No.
Oh, it's so good. It's so applicable all the time. Don't miss this book. It's really good. So I decided I could no longer work for someone else. I had to work for myself. And because I had a military commitment still, I went for 1 year and worked for another doctor in the town where I was in Atlanta, outside of Atlanta. And then when my military commitment was up, I said, hey, I want to buy your practice. And he said, you can't pay me enough. So I walked down the street and hung a shingle and took about 1,000 patients with me.
Oh, wow.
So Yes, that was great. And we built and built and built. The practice got really big and busy, and that was really great. And then about 10 years later, I started to see patients who were sick but didn't have anything that was obvious on their lab work or their, everything looked normal. So we, at the time, treated you with Prozac, or we treated you with, if you had a blood pressure problem, we treated you with blood pressure medicine. Now I'm going to look and see what the reason is why you have that. So it was a different kind of way to practice. And I kept getting frustrated with because I knew something was wrong and I couldn't help the patients to figure out what was wrong.
Right.
So I had a really blessed situation. This patient came in to see me and said, "Hey, I want to get bioidentical hormones. Can you write my prescription for me?" And I said, "I don't know how to do that, but I'll copy your prescription." So I just copied the prescription and sent it to the compounding pharmacist. And I didn't even really know at the time that a compounding pharmacy existed. So the compounding pharmacist called me and said, "Hey, you clearly don't know what you're doing. Can I send you to a conference?" And sent me to this great conference where the scales fell from my eyes, and I learned that there was a whole other way to practice medicine, and that there were tests we could do that really revealed what was going on with people that were not mainstream testing, that were not covered by insurance. And it opened up this whole Pandora's box of things I could do that would be different and helpful. And so a whole bunch of people got better all of a sudden that weren't getting better. And then there was still this little, maybe 20% of patients that weren't getting better. So I went back to school again and learned some other things that helped that 20% of people get better. And then there were still 20% that weren't getting better. And so I went back to school and got a bunch more things and learned about Lyme and learned about mold and learned about bioidentical hormones and learned about peptides. That was my own injury, was the trigger for that education, and couldn't get over my injury for a while. So I went to a conference where I learned about peptides. It was actually just one of the small breakout sessions at the conference that I went to, this huge, like 2,000 doctor conference. And it was just a little small breakout session. And I was like, wow, this is amazing. I need to learn more about these peptides. And took a course and then started teaching about a year after that course that I took. And the teaching, because when you teach, you learn more and more and you get better and better at it. So one of my favorite things to do is to teach, both because of the education that it provides me, but also because I feel like I have a great ability to pare things down so people understand them in a way that people can grasp.
Oh, that's wonderful. And just hearing you say that kind of stuff, it really excites me, because I am such a huge proponent of homeopathic medicine. I actually have two. I was diagnosed with leukemia 10 years ago, CLL.
Oh, wow.
But I just had a doctor visit today with my oncologist, and still no treatment. I truly attribute that to eating clean, working out, doing all the things in that realm, but also, going to my homeopathic oncologist and getting, monthly IV drips, doing hyperbaric oxygen therapy. I mean, I do a lot of like biohacking myself. And when peptides came along, I just thought, oh my gosh, I just have to add this to the bandwagon. It's one of these things where I guess it's been around for a while, but now it's just coming into mainstream and it's really becoming popular. And most of my listeners are over 50. So I'm thrilled to be able to share this information, because it's so valuable in so many different avenues, not only just for general health, but if you wanted to lose weight, I mean, all the big things now, the Mounjaro and the Ozempic, those are peptides, so, and if you want your skin to improve, then we've got the copper peptides. And if you get injured, then there's other peptides for that. And so I'm just thrilled to have you, because I've got a bunch of questions. And if you're ready to, for me to fire away, let's get talking into peptides.
Yes, I would love that.
So let's just start off and just tell everyone, what are peptides?
So the thing to remember, first of all, is that most of these are naturally occurring, meaning your body naturally makes them. All we're doing is creating in the lab the exact same thing. So when we talk about like bioidentical hormones, for example, it's the exact chemical structure of what your body naturally makes. So most of these peptides are the exact chemical structure of what your body makes. Now, the ones that are owned by pharmaceutical companies, they have to slightly modify them in order to own them. So you can't patent something that's natural, like vitamin C, you can't patent, but you can patent vitamin C plus blah, 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 whatever they want to put on it. Mm-hmm. And so they'll modify the molecule very slightly, and that's how they can patent it. So the ones that are available from a pharmaceutical company are not 100% natural, but they're very close. So the famous weight loss liraglutide, which is I forget the brand name. I believe it's Victoza. This one is a slightly modified. It's 97% homologous with the molecule GLP-1 that your body naturally makes. So the modifications have actually been beneficial. They allow the peptide to last longer in your body. So that's just one that's available, that's out there, and that's just an example of how it's modified. Most of the time, the modifications are to make the peptide last longer, because our body naturally, with these peptides, which are strings of amino acids are the building blocks. So think about a chicken breast. There's lots of protein, we know, in a chicken breast. Proteins are anything longer than 150 amino acids in length. So we just line them up, more than 150, we call it a protein. If it's between 50 and 150, we call it a polypeptide. If it's less than 50, we call it a peptide. And it's less than 4, we call it a bioregulator peptide. So the peptides are fragments of these longer proteins that either were created initially or were broken down by enzymes in the body to make this smaller peptide. And each of them, I like to think of them as the construction worker or the signaling agent. They do tell the cells what to do. So the action of the actual peptide is usually very quick, super fast. It will cause things to happen inside your cell, and then that entire cascade of things that happens continues on after the peptide is gone. And we kind of want it that way. We don't necessarily want a continuous, signaling of that cycle to go. So the peptide will tell, if we're continuing with the construction metaphor, the peptide acts like the construction boss, and it tells the plumbers and the electricians and the framers what to do, and they then all those groups go and do their jobs. That's a good
analogy. I love it.
Yeah, I think it works really well for most people. So that's the way that most peptides work, is by acting as a signaling agent, and then all the other things continue happening after the peptide has been digested. And then those little pieces, those amino acid fragments, can be used in other places. And in fact, we've discovered that some of the things we were using as peptides, now, if we break them into smaller fragments, we can use them for other things. So, for example, the peptide BPC157, the peptide melanotan, which is designed for tanning and libido and anti-inflammatory purposes. If you break it up, you can get just the tanning portion, or just the libido portion, or just the anti-inflammatory portion. So the small fragment KPV, which is a 3 amino acid bioregulator peptide, is available, and it's very anti-inflammatory. So people will take that for things like arthritis or for things like autoimmune diseases, et cetera. So very interesting and really great. Can be useful in things like Lyme disease and mold exposure and all those sort of things. Hashimoto.
That's amazing. There's just, and also too, there's just so many peptides.
Right.
And so I want to talk about peptides in general, and then I want to break it down and talk about bioregulator peptides, because I find those fascinating. As a matter of fact, I just started taking 2 of those, and I'll have to get your opinions on that. But you just told us about the peptides themselves. So the first questions that I think that the consumer is going to ask is, well, are peptides safe?
Sure. So most of the research that's out there, except on the ones that are available as pharmaceuticals, most of the research that's out there is done in animals. We don't have a tremendous amount of human research. Now, some of them do have human research. BPC 157 has a human study on intra-articular injection, so in the joint. Liraglutide has an in the joint injection, but it has tons of human studies on diabetes, treating diabetes and obesity. So that's a good one. But the ones that are available otherwise don't have a tremendous amount of human research. They have a lot, probably way more research than a lot of other, even pharmaceutical drugs have for in animals, but not a whole lot of studies that are available in humans. So the answer to your question is we think so because they're naturally available. Your body naturally makes it. Can you overdose? Is there probably a Goldilocks window of too much or too little? Absolutely. And so that's what we really think, because these are things that your body naturally makes. When we replace them, we're restoring the more youthful state of your genes, the more youthful expression of all of your proteins in your body.
Right. So who would be, in general, a good candidate for peptides?
So I would say most of the time, these peptides are depleted as we age. And I would say most aging begins around 35. Obviously, it's a bell-shaped curve. You're not going to, at the age of 35 suddenly be old. But we think about the body in terms of reproduction. And as you approach and pass reproductive optimal age, then your body's going to start turning off some of the genes that are related to being more youthful, unless we're doing something intentional to turn that around. And we know that genes are the blueprint to make these proteins and peptides. So we don't want them to be turned off if they're proteins and peptides that signal a very youthful expression of your cells. So if we can thwart that intention of turning things off as we age, turning the more youthful expression off as we age, then that's our goal. So I would say average age 35. Now, where that doesn't apply is someone under 35 who's an athlete. So if we're talking about recovery from injuries, that's where we really want to focus on. So there's really not a too young age for helping with recovery from injuries. Your dosing will just be smaller because they're not going to need as much. They're going to make their own. So we know that when there is an injury, one of the first messengers that comes along is IGF-1, which is produced by the liver in response to growth hormone. When there's an injury, IGF-1 comes to the area of the injury and is converted into a couple of different forms of itself. It has several different isoforms of itself. And it will transform into the repair versions very quickly, causing a cascade of action that triggers the inflammatory and then anti-inflammatory response to cause healing and then turn the healing process off, because we want it to heal till it's healed and we want it to stop healing when it's done. Continued healing is where we run into problems too. So that's the way that these will work in a younger person. That's the way they work in older people too. They just aren't going to need such a huge dose because they're going to do it naturally themselves.
Right. Right. And so how are peptides administered?
It depends. So there are many that are available orally now, and lots of companies are working hard to figure out ways to make them orally available. There are several companies I know. Elite Athlete, I think, is what it's called. They're out of Texas. They're trying to come up with several. They call them lipotabs. You can find them on Instagram. They're to put a lot of the peptides in an oral form, so it's bioavailable orally. Most of them are available injectable only, and that is a subcutaneous injection with a tiny insulin syringe. Most of my patients, if I just walk them through it right in the office with me, they're fine. They're like, oh, that was nothing. And they go about their business not worried about the injections. So really the systemic administration that way is the best way to go for most patients. But they are, scientists smarter than me are working hard on coming up with alternative administration routes.
Right. And I think I did see too, that you can take some of these peptides
nasal through like a nasal spray, right? Is that
exactly? There's VIP is available as a nasal spray. Oxytocin is available as a nasal spray. C-Max and C-Lank are available as nasal sprays. And they're working on several others. PT-141, which is the libido peptide. They're working on that one being available by a nasal spray. We do have to be careful because sometimes they'll raise blood pressure when they're administered that way. So we just have to be aware of people's blood pressure when they administer them that way.
right? I know personally, terrified of needles my entire life. I mean, I still am traumatized by thinking back when I was 5 or 6 years old and going to the doctor and getting shots. And up to this past year, a year and a half ago, when I started doing, I did bioidentical hormones when I was in my 50s and then stopped. And then I compete in bodybuilding shows and I'm working my tail off in the gym and I'm not showing any results. So I thought I need to get a hormone panel done. So I went, I got one done. And my OBGYN was like, your hormones, I'm 66. And she was like, your hormones are pretty much where they're supposed to be. And I'm like, but that's unacceptable. I'm competing in bodybuilding shows. I need some testosterone. I've got this unexplained bloating going on. I'm thinking maybe it's just lack of estrogen. And she refused to do anything for me and just said, this is where you're supposed to be. And I'm not going to help you. And then she also said that, well, and if you're having issues around your belly, why don't you look into cool sculpting?
Oh.
I can laugh about it now. I was so angry. I'm like, I compete in bodybuilding shows. This is not visceral fat, But anyway, I never went back to her. But I have a great wellness doctor now that I go to, and I am on bioidentical hormones. And the first time I had to give myself a testosterone shot, I was freaking out. But just like you say, it's just that initial puncturing the skin. And then I was like, that was nothing. I mean, literally. And then I'm like laughing at myself thinking all those years I was so terrified. And now I'm like giving myself shots all the time. So
yes, exactly. That's wonderful.
It's like, and even my sister is queasy. She has to lay down. And I just thought, well, just be known to you that if something ever happens, I can give you a shot. So
do you feel better on them?
Oh, yeah. Oh, yes. Yes, absolutely. Absolutely. I mean, the testosterone has helped me, tremendously in the gym. I mean, overall, everything is better. I mean, my hair is growing. I mean, my nails are growing. My skin looks good, so yes, I'm very happy. I don't have any intentions of going off hormone therapy. And there's a lot of women out there who are suffering, going through menopause, and they are not really willing to go that route for whatever reason. But I'm just like, oh, you could avoid so much pain and anguish and stress on your body. But
there are 2 huge, really good studies that just recently came out. I know we're not talking about that today, but on using subcutaneous testosterone and the diminished risk of breast cancer with using subcutaneous testosterone. So one of them was they're both subcutaneous injections. Most of the study participants were actually using pellet form of testosterone, not just injections, but subcutaneous testosterone, and they had really, really great outcomes. So definitely worth a consideration.
Right. Well, I even spoke to my oncologist about it, and he was just like, I'm fine with it. He said there's been studies originally that they were saying, if you take hormones when you're over 60, it's going to be detrimental to your health. But they've kind of done a circle around and done a 180, I think, on that. So obviously with these tests coming out too. So these test results coming out. So I'm excited. I feel great. And I continue to love them. And I continue to push them to people I know in my age category.
Mm-hmm.
So if you wanted to, this is a good question. So once you start taking a peptide, about how quickly can you see results?
So it depends on what we're trying to treat. If we're treating an acute injury, it can be as quickly as a couple of days. So in the office, we do injections of tendons and joints that have been injured, and those can get results within the same day or the next day. Those treatments, the full course of treatment usually requires about 6 months total of treatment, but people have complete recovery from things like meniscus damage or, chronic tendonitis that's been present for months and months and months, and they get recovery from those. So back to sport and back to activity, which is super exciting.
Right. And so do you feel that it's more beneficial to do the injection at the site of the injury or subcutaneously through the stomach? I mean, and have that systemic effect?
It's a great question. So you're going to get a systemic effect regardless. The question is how much of it's actually going to get to the site of injury if you inject it in your stomach and the site of injury is your elbow. So what I tell patients is these can go anywhere in your skin, and the majority of the work is going to occur wherever it hits first. So the closer you can get to the site of the injury, injection-wise, the better. So if I have a patient who has an elbow injury, I'm going to have them inject either in their forearm or their upper arm with the intention of getting that to the site of injury. So as close to the site of injury as possible. But even if you inject it, in your abdomen or buttocks, it's still going to get there. Just the highest concentration won't be there. It might run into another injury on the way, and it'll use up all of it on the way there.
Well, I never thought about that too, because I think a lot of us, especially at our age, you do start developing maybe some arthritis, and you do, like, for example, I was having some right knee pain. I had an MRI done. The cartilage behind my kneecap is pretty much gone. I went to physical therapy for that, and my knee feels 100% better. But I think that's kind of true if I'm injecting this, we'll talk about this in just a minute, but I'm taking a specific peptide called TB500 that helps, with injury. And, I am injecting it in my stomach, but I've got this torn rotator cuff, and I'm like, well, maybe I should be injecting it up there. But by myself, it's kind of hard to say, okay, well, I'm left-handed. It's my left shoulder. So I'm like, how am I gonna do this? Trying to, maneuver this needle into my shoulder on my own. I don't really know anybody else who would want to voluntarily give me that shot. But no, I mean, I honestly feel, and I've been a big proponent with my family and stuff too. I'm like, you guys should consider taking this, and here are the studies and here's the research. Talk to your doctors about it. But I do have to say, Dr. Ferree, that it really, like when I mentioned to my oncologist that I wanted to start taking peptides, and he was like, I don't know anything about them. And when I talked to my GP about, he's like, well, what kind of supplements are you taking? And I'm like, well, I've added BPC 157 and TB500. He's like, what is that? And I go, oh, they're peptides. Don't know anything about them. And so it's a little frustrating to think that Western medicine, once again, is going down that big pharma lane, and their peripheral vision is very narrowed. And there could be a lot of, causes and injuries and illnesses improved if the scope was just opened up a little bit further. And so I'm actually going into my oncologist, and I'm sharing information that I have learned with him, and he's very grateful, but at the same time, he doesn't know anything about it. So it's frustrating, right?
Right. Well, and we just have to remember and be grateful for them, because, or they gracious to them, allopathic doctors, because truly most of them are seeing 30 patients a day. They work 7 a.m. to 7 p.m. or longer, and they don't have time to sit and listen, and they don't have time to go and learn. So most of what they learn is from when they go to medical conferences, which are sponsored by pharmaceutical companies. And most of what they if they do spend time learning, it's pretty small, and it's also, the education is sponsored by pharmaceutical companies. So it's tough for anyone to learn outside of that. I intentionally read 3 to 5 journal articles every day, and it's specifically on peptides, because that's what that's what obviously my passion is, or where my area of interest is. And also, I'm concerned about the distance between bench medicine and practical clinical medicine. And one of the things that makes that gap so wide is as doctors in general, our resistance to learning something new. And the other thing is the huge hurdle that the FDA is. I understand why they're in place. I respect and appreciate their intention, but I also know that there is lots and lots of really good treatments that are out there that are either natural, as you suggested, or that are slightly modified versions of what our body naturally makes that can be useful in treating various disease states, and that are not even being considered because there's a lot of reasons why they might not be considered, but because of some secondary motivation that might not be related to the best interest of patients.
That's a great way to put it. I was very alarmed too when they came out. Has it been 6 months?
Yes,
about
September.
The ban on peptides and certain specific peptides, and so it was like, okay, well, Big Pharma wants a piece of that, and so they're going to have to look into that before they allow that. So you're 1,000% correct on what you how you described that.
Well, let me make it clear, because they were not actually banned. The peptides were not actually banned. What they did was they moved peptides, a big chunk of the common peptides, from category 1, which means that compounding pharmacies are allowed to compound them, into category 2, which means compounding pharmacies are not allowed to compound them. They did not do that because of lack of efficacy, and they did not do that because of any adverse effects. So I'm just going to kind of put that period right there.
Okay.
But they did
perfect.
not prevent us from prescribing or using them. They just prevented compounding pharmacies from making them. What I fear is happening now is that most of our clients are going to begin going to off-label sources, black market sources, to find these very effective peptides, and they will get product that is dangerous for them, because if the process is not specifically followed, there can be some serious side effects: liver disease, liver failure, neurocognitive disease, and we don't want any of that to happen. We know that that's unlikely to happen if it goes through a regular compounding pharmacy, because they are third-party tested for human safety and for purity. But the FDA said we are not allowed to, that compounding pharmacies are not allowed to compound them. So they weren't banned, they were just moved to category 2.
I'm glad you brought that up too, because I listened to a lot of podcasts and I found some really great reputable websites that do third-party testing, and they'll send me a certificate of analysis with each order that I put in for. So
Great.
That's really, really helpful and mind-soothing to me. But a lot of people, just like you said, will go online and Google peptides, and then the first thing that comes up, they're not doing any research on that specific company. So I thank you for bringing that up. So let's just dive into some specific peptides. One of the, I think, the most well-known peptides is BPC 157. You've actually mentioned it a couple times here on the podcast. So let's talk about that specifically.
Sure. This is a fragment of a naturally occurring peptide in your stomach that in the stomach is used to heal ulcerations, wounds, any sort of trauma that occurs to the mucosal layer. It works by improving blood flow to the area. So that's where its primary use is. But in some significant animal studies and one human study, we drop those into the onto tendons that have been transected. So we take a rat, we transect their Achilles tendon, for example. We drop the BPC 157 onto the transected Achilles tendon. We hold that tendon still for a minute, and it's not a minute, a few days. It's able to repair. The coolest thing about BPC 157 is we're able to see that tendon repair. Not only that it's able to repair, like with a scar, for example, and then you have to rehab that joint. No, it repairs in a normal, organized fashion that is not scarred, and the limb has return of function back to normal function. So this is fascinating. So not just does it repair intestinal lining, but it repairs tendons and the esophagus. We've seen that. So what they did was you could restore the lower esophageal sphincter tightness. So in people who have heartburn or reflux, and they take the study was done with animals, they did a pH probe down their throat. So they watched them swallow, and they had a chemical that injured their lower esophageal sphincter, that sort of tight band that's between the stomach and the esophagus. And they watched, after they treated them with BPC 157, that the restoration of that tight band, so they no longer experienced reflux or no longer had that reflux of stomach contents into the esophagus. So that's amazing. Nothing else we do can do that. So that's exciting. The BPC 157 has some really interesting studies in rats with traumatic brain injury. So they would drop a little weight on the rat's brain, and they would see what would happen. And the rats that had the BPC 157 on board when they had the traumatic brain injury had much faster and more complete recovery. And I think it was I'm sorry, I don't remember the number right now, but a significant number of the rats died in the control group that did not get treated with BPC 157 versus the treated BPC 157 group. So this is also something to consider adding to your armamentarium. Again, as you were suggesting earlier with what's your age group, and I was saying athletes, this might be something I would include in my young athlete, especially someone who's playing a high contact sport like football.
Mm-hmm. And you can orally take that, and you can also inject it, correct?
Exactly.
Okay, great. Let's talk about some of the weight loss peptides that are out there now that have become pretty infamous, and your thoughts on those.
Sure. The original peptide that your body makes is called GLP-1. And this is a fascinating molecule. It has so many amazing beneficial side effects or effects in the body, both not only on the pancreas, as we know with the diabetes treatment that it is, but also telling every single cell how to make and use energy more efficiently. So not only does that work on the pancreas, on the muscle, but also on the brain. So these the original studies with these GLP-1s were done in patients with neurocognitive disease, like dementia, Parkinson's disease, et cetera. And those patients did amazing. However, they lost too much weight. So they said, wow, this is maybe something we can use in these patients. And they got really great results in those patients. There is evidence of its benefit in things like kidney disease, liver disease, heart disease, so many other things, brain, as I mentioned, cognitive disease. So there's a lot of reasons for people to stay on them long term. If I have patients who have used it for weight loss or diabetes, and they say, oh, my diabetes is gone, oh, my weight's down to my normal weight, I will often keep them on a much lower dose of the one of these peptides in order to maintain that effect. Now, there's no specific study to show that that benefit, if you continue it, that it's able to prevent that disease. But we do know that there is a very positive effect on those various organs. So that's just a conversation I have with all of my patients. Let's say you came in to see me and say, hey, I wanted to lose 30 pounds. I have so-and-so that I want to do, and I need to lose 30 pounds. And so we reached your weight loss goal with that. And you said, oh, by the way, my mom and dad both died of dementia. And it's really something that worries me that I would have that. And I would say, well, this might be something that you want to stay on long term. So we drop your dose down to a maintenance dose, and then where you weren't continuing to lose weight. And then hopefully we would be able to get some continued benefit in the organ, the target organ we were looking for. So far, I've had some pretty great results with heart disease and brain disease in those clients. So it's exciting.
Wow, that is exciting. Let's talk about, since we're talking about athletes, and I'm an athlete too, let's talk about some of the healing peptides that are out there.
Mm-hmm. As you mentioned, BPC is on my list. I use thymosin beta 4, which was the original longer molecule or peptide that's out there. Thymosin TB500 is a smaller, slightly different version of that, but also can be effective. The other ones are AOD, and AOD is a fragment of growth hormone. They call it AOD because it's anti-obesity drug. So it was originally studied as a weight loss medication. It works pretty well as a weight loss medication, but it works really well in helping people with injuries or recovery. So I use that in my as one of my treatments for joint and tendon traumas.
What about longevity?
Yes. So there's lots of things we use for longevity. I love doing some of the senescent cell treatments. So I will use, I love thymosin alpha-1, which helps with immune health and immune aging. We'll use that in a lot of different cases. We think one of the things that contributes to our aging process is the accumulation of viral illnesses that just sort of smolder along but hang around. So EBV, CMV, et cetera. EBV is Epstein-Barr virus, CMV is cytomegalovirus, and other viruses that overload our immune system as we age. And so if we can keep those at bay with a peptide like thymosin alpha-1, we should be able to get some good results with reversing some of the downsides of aging. We also use some of the senescent cell treatments. And senescent cells are what happens in our body as we age. Some of our cells they just get overworked. And instead of turning off and going into an apoptosis state where they're dying and being packed away and recycled, instead of doing that, they become this other thing. We call them zombie cells a lot of times because they attract our natural innate stem cells to them. And then those stem cells also become zombie cells. These zombie cells constantly secrete inflammatory, I call them like henny penny. They're constantly secreting inflammatory chemicals to the whole body saying, oh my gosh, the sky is falling, it's terrible, everything's awful. And we're creating more and more of a traumatic environment around in our organs. So our organs don't function quite as well as they would otherwise because they're constantly being bombarded with these inflammatory chemicals. Things like FOXO4 can help us to remove those senescent cells from our body so that we can now function in a more rejuvenated state. This is available in an IV form. FOXO4 DRI is available in an IV form. And it's done once or maybe twice a year. I also will use some of the bioregulator peptides like epitalon, and that's also done periodically, usually once or twice a year, depending on how old you are. And you can do that you can do it very often. I have a nasal spray version of that I use, and that's also very effective. Yeah, so depending on where you get them from, you can get a nasal spray version, you can get a under the tongue version, you can get injectable, you can get an oral. I really like the nasal spray version.
I've done 3 rounds of that, and it was like a 10-day injection, I think, and every 6 months. So I'm hoping, and now that we're talking about that, that really has a big effect on your telomeres. And so we talk about telomeres and how beneficial this one peptide is.
So I'm a big fan of, I appreciate telomeres and I appreciate what they're signaling. So telomeres are the ends of your DNA that are sort of a tail on the end of your DNA. And every time your DNA replicates, the telomeres get shorter and shorter and shorter. So we can tell approximately how old you are based on how long your telomeres are. Now, there's not a lot of science demonstrating that if we lengthen telomeres, that we're able to lengthen life or improve longevity. It makes sense in theory, but we don't really have a good study to support that. So I'm still in the reserved category, not jumping on the bandwagon of telomeres, although I think there is some evidence of benefit. The most recent interesting evidence of benefit is there's an oral that's available, that a capsule that lengthens telomeres, and it also has some really interesting evidence of benefit in restoring testicular function in men who have lost that in fertility situations and men who've lost testosterone production. So that's kind of interesting that it does have that benefit when we're talking about is it because of the telomere lengthening? I don't know that for sure, but we do know that it does have that additional benefit. So that's kind of cool.
That's great to know. Back to the senescent cells. I listened, like I mentioned before, to a lot of podcasts, and there are supplements out there now to help basically come in. I always think about a chimney sweep, comes in and cleans up these zombie cells. I mean, are you a proponent of some of these supplements that are out now?
So there's some limited evidence about a really cool polyphenol that comes from plants called fisetin. So there's some interesting evidence using fisetin. It's not conclusive, but very interesting. There is a combination called dasatinib and quercetin. Quercetin is another polyphenol, and that combination has some really interesting evidence. It does come with a lot of potential side effects. And remember that the process of senescence is not always evil. Senescence is useful when we're trying to change the way our body shape is, when we're trying to, there is some benevolent senescence that occurs. So I don't necessarily want to remove all the senescent cells. Let's say you cut your hand. The leading edge of that cut is senescent cells. We want them to be there to help with that repair and recovery. So I'm not sure that we want to get rid of all of them. And I think that's why dasatinib and quercetin, although it helps you to get rid of all of your senescence or a good number of senescent cells, I'm not sure that's my favorite way to do it. I really like the spermidine products. So there's several of them on the market now. And I think that's a really good way. I love rapamycin, sirolimus, rapamycin. I think those are good ways. We're sort of doing that in a secondary way with those products. Giving your body the chance to do its own autophagy on its own. So you're clearing any cells that might be struggling rather than allowing them to go to the senescent phase.
Right. Great explanation. Thank you. Okay. So what about some peptides for cognitive function?
So we use in our office quite a bit of cerebrolysine, and there's one called dihexa that's really lovely. Dihexa is a nice anti-inflammatory and pro-growth peptide, nerve growth peptide. It's one of the ones that has been banned or has been moved to category 2. And so we are having a little more difficulty finding it, which has been such a struggle. It's been very effective in treating some patients with neurocognitive diseases like MS. So that's been frustrating for those clients who haven't been able to get what they need. That's been so helpful. The cerebrolysine is really helpful in patients who have dementia, memory loss, early onset memory loss, and in folks who even are in their 50s and 60s without significant dementia, but who are starting to notice, I'm just not as cognitively intact as I used to be. I play guitar, for example, and I can't memorize my chords like I used to. I'm a sport person, and someone will give me the list of different activities I'm supposed to do, and I can't hold that list in my mind. Or I'm a dancer, and the steps are escaping me more than they were before. So that is one of the things we'll use. Several of the categories will use something like cerebrolysine in, and patients will come back with those reports like, oh my gosh, I can remember my lines. I can remember my steps. I can remember my chords, whatever it is that they're trying to hold on to. My clients' names. I can remember clients' names where I couldn't remember anybody's name before.
That's fantastic. Wow.
Yeah.
It's really great. Let's break this down to another, like a subsection here, and talk a little bit about bioregulator peptides.
Yes. So bioregulators are really small. They're 4 amino acids or less. And there are several that are available that we've studied. There are hundreds of thousands that are out there that just haven't been studied as extensively. And there are several that are easily accessible. Probably my favorite and the most famous is glutathione. If you're familiar with glutathione, it is a bioregulator peptide. It acts specifically as an antioxidant in the body. It is the strongest antioxidant we've got, probably. And it works on all of those centers where our bodies have a heavy load of oxidative stress. And so I love glutathione. I think it's a great molecule. I love the spray glutathione. I don't know if you're familiar with that, but it's one of my favorites right now. It's a topical. It's because it has sulfur in it. It has a strong sulfur smell when you spray it on, but as soon as it dries, the smell goes away. So that is one of my favorites. It's a very liquidy. It's not like a lotion. It's like putting water on your skin. It's pretty rapidly absorbed, and then the smell again goes away. So that's one of my favorites. We also do a lot of that IV, depending on what the patient is dealing with. And it's, again, a Goldilocks situation. The higher the dose you go, you may have side effects. People will get what we call a Herxheimer, or a very uncomfortable, maybe even to the point of fever feeling in their body, depending on if they go too high. But too low a dose, they're not going to get not much effect at all. A lot of my patients will use this as they travel. So they'll come to the office, they'll get an IV of glutathione right before they travel to help with all of the exposures they know they're going to have when they travel. Hotels don't have bugs because they use pesticides, and their lawns are gorgeous and landscaped because they use herbicides. So all of that exposure in our bodies, plus the food that we're not used to eating, plus the radiation exposure when you're up that high in a plane, all of that is a lot for your body to handle. And taking something like glutathione, a good antioxidant when you travel, is super helpful. My second favorite is one called SS31. This is a mitochondrial peptide. It is also under 4 amino acids in length, and it works specifically on the mitochondria to improve the way they are able to make energy. There's so much research in kidney disease, liver disease, heart disease using that peptide specifically, and I love getting the chance to put people on it, because when they do, their energy is huge. In fact, people will say, "Can I take it more than 3 days a week?" And so we sometimes will run it up to 5 days a week. And I had a patient who had a pulmonary fibrosis that she got as a result of COVID many years ago. And she was miserable. She was near death. She wasn't going to survive because of her pulmonary fibrosis. And we treated her with that plus several other things, and she got much, much better. So as far as her energy, her ability to walk without oxygen, amazing. And then there's several that are much more familiar, things like epitalon that I mentioned a minute ago about longevity. Then there's also several that are available orally, Ventfort and chondroitin, and several that are available orally that work really well in combination in stacks. And I have a stack of them that I take every day as part of a study group where we are being tested. Our telomeres and our immune aging are being tested annually to see if we have the same outcomes. The Russians had amazing outcomes using this stack of thymus and pineal gland peptides, as well as other peptides that your body needed. And we're hoping that we'll see the same results here in the US.
That's amazing. I've learned so much about bioregulator peptides. And I think what's so great about them is that some of these, all of these peptides are, like organ specific. And yes, you can literally read these studies to see that diseased organs are, restored to almost their original undiseased state. And it's just incredibly fascinating.
It's really interesting. The Russian research in these is really impressive. The longevity. So what they did was they put a group of people on them that were in their 60s, and every person took a stack of them every day. So stack meaning 4 different of peptides, and 2 of them were the pineal and thymus gland peptides. The pineal gland in the brain is pretty cool because it's kind of like the kidneys of the brain. It acts like a filter for all of the cerebrospinal fluid as it goes through the brain. The pineal gland also is responsible for making melatonin and for bathing the brain stem cells in the cerebrospinal fluid. So it's the baby stem cells that are in the brain that help with recovery of the brain tissue. That pineal gland produces all that cerebrospinal fluid to bathe these baby stem cells, sort of protecting and fostering their growth. So if we do pineal gland and thymus gland because of immune system function. And then we add other peptides based on your particular body, your particular family history, your particular needs. Like for me, I end up taking an adrenal gland because I have some stress. And I end up taking the cartilage and the muscle and bladder. I think that's the main ones I take. Okay. And so we'll do a stack of those and we'll cycle through. I take the blood vessel one periodically. I take the bladder one periodically, et cetera. And that we'll cycle through those. The research with this was a huge study. It was like 10,000 people. They gave those stacks to them every day for 3 years. And then that was it. That was the whole study. 15 years later, they called them up and said, "Are you still alive? Are you still alive? How about you? Are you still alive?" And significantly higher numbers of people who had taken the peptides were still alive than in the placebo group.
Wow.
So it's pretty dramatic. And then they also had the same effect when this same treatment was given to patients who were older. So one group started out at age 35 or 40, one group started out at age 55 or 60, and then they followed those for 15 years and retested. The older clients had even better results. And when you add the pineal and the thymus gland peptide, you have better results. So I would be sure to make your pineal and thymus gland peptide part of your regimen all the time if you're taking bioregulators.
That's great advice. And also, too, I haven't started taking it yet, but the whole muscle cartilage thing, as an athlete, is very appealing to me also.
Absolutely. And, the Olympics team for the Russians did for many years take all the bioregulators.
Right. I actually even did I did my first round of bone marrow peptide just because of my leukemia, thinking, well, obviously this may help. So I'm kind of excited.
Well, you think even the pharmaceutical companies have been doing this for many years. Think about our thyroid peptide. This is the Armour thyroid or NP thyroid or WP thyroid. This is very, very similar. So these are derived from calves, 1-year-old calves, and they are derived from a very healthy source of 1-year-old calves. And they just take the gland, they desiccate it or dry it out, and they put it in a capsule. So that's what we're dealing with. Same thing as with the Armour or the NP or the WP thyroid. So you're getting all kinds of other nutrients that are supposed to be in that gland, as well as the peptides that are in that gland. And you're not getting just one peptide like you do with epidolon, for example. Epidolon is the chemical, the single peptide that's in the pineal gland peptide. So if you can instead take the entire glandular product, wow, that's you're getting all kinds of, if you need a B6 or a B12 or whatever is part of the machinery of making those peptides work more efficiently, it's all there in those bioregulators. So that's what's exciting about taking these glandulars.
So we've talked about peptides and bioregulator peptides, but now let's talk about people who may have certain diseases like cancer. Because some of these peptides are growth hormone related, and we don't necessarily want to be taking a growth hormone. I'm thinking if we have cancer. Am I on the right track?
You're right. So some of them have research. For example, thymosin alpha-1 has research and that is a naturally occurring peptide. It's synthetically made to be exactly the chemical structure of your own thymus gland peptide that's produced by your own thymus gland. Your thymus gland produces that in much smaller portions as we age and as we have disease states occur. So we know that if we can replace it, we can improve your immune response. And there's lots of studies using it for cancer, for COVID, for viruses, et cetera. So all kinds of things to look at there with the cancer. I typically don't prescribe very many peptides in active cancer patients, except for thymosin alpha-1, because it does have such good research. I do not believe that these cause cancer, but they can cause a cancer to grow. Right. So we just need to be aware that that's possible. And if someone is being actively treated has an active cancer, I'm going to take them off. As soon as their cancer is resolved, then we start them right back on their regimen.
Right. That's great. So what about, can you talk about women over 50 and give some recommendations? Let's say maybe your top 3, top 5 for women over 50.
Yes. So I think what I would always start with is one of the growth hormone secretagogues. I like to call it youth hormone rather than growth hormone because of how it works in the body to help with restoring the cell's natural ability to make and use energy. And so if we can help your cells to do that, we can increase the number of mitochondria per cell. So now you have more energy generators. We can improve the way that the mitochondria communicate with the nucleus so that we're getting all kinds of cooperation occurring, and the cells are functioning more optimally. So hair follicle cells, skin cells, intestinal cells, all of those are functioning more optimally when we're doing some sort of growth hormone secretagogue. And there's lots of them out there. The one that's FDA approved is called tesamorelin. There is one that's available that's shorter acting that is not on the move to category 2 list, and that is called sermorelin, SER. And so we use those primarily right now. I love tesamorelin. There's so much great evidence. It's FDA approved for a condition in HIV patients, which causes unusual fat deposits all over the body. But its effectiveness is in its ability to produce additional growth hormone. So if I'm giving it to you, you will naturally secrete growth hormone with exercise and with sleep, and maybe 4 or 5 more times a day as a woman. So we want to give it around bedtime so that we're enhancing that production of growth hormone. We're optimizing that production. As we age, our growth hormone production goes down, 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 just like the rest of our hormones do. And so if we can optimize that hormone production back to a more youthful state, I don't mean 20, I mean, if you're 50, I want to get you back to 40. Then we'll be able to have your cells function at a higher vibration, a higher level, and then the cells are able to do their job in a more efficient way. So we're not seeing that aged expression in people when they're doing this. So probably my number one anti-aging, and for people over 50, for hair, for nails, for skin, for intestinal health, for heart health, for all of that, is using one of the growth hormone secretagogues. I would then pair that with one of the thymus gland peptides. And depending on whether you're an athlete or not, I might start, or what your other illnesses are, I might start with thymosin alpha-1 or thymosin beta-4. Thymosin alpha-1 is much more as far as immune regulation goes. And thymosin beta-4 is, I think of as repair, recovery, restore kind of peptide. So that combination, you can of course do all 3. That's a really brilliant stack to put the 3 of those together. And then I would do cycles of some of the other peptides. I might do an SF31. I might do a FOXO4-DRI. I might do, I love oxytocin. I think there's tons of reasons to use it. It's not something I would use in everyone, but I really am a fan of it. The interesting research is in weight loss. You wouldn't expect it because it's called we call it the cuddle hormone, but there's some interesting research in weight loss. There's some interesting research in bodybuilding, and particularly in osteoporosis. So that is something I will add on to my osteoporotic patients. If you're very thin and you don't do a lot of bodybuilding or weight training or any resistance training, then oxytocin is going to be higher up on my stack of recommendations. If you're having trouble with your circadian rhythm, if you're traveling to Frankfurt, for example, and your circadian rhythms are off, I'm a big fan of VIP as a nasal spray. I think this is a really great peptide for all kinds of reasons, but in a lot of patients, I'll use it for that if they're having trouble with sleeping. This you would use when you arrive in your new place at that time zone. You'll use it in the morning for that time zone. And if you're really struggling with kind of being present, you use a couple more sprays. So not just 1 or 2, you'd use 3 or 4 or 5 or 6 if it's a longer distance. So if you're traveling, for example, to China, you might use more than if you were traveling to Frankfurt or whatever the distance is, whatever, and everybody's body is different, of course. Right. But what you're going to see is it's really helping to increase the production of NAD in the morning It turns on those clock genes in the morning, and then you'll have your normal nighttime. So I have them take melatonin or something like that in higher doses at bedtime of the new location where they're going, and then the VIP nasal spray in the morning. This is for my travelers. And then when they get back, when they arrive back to wherever their normal home is, I have them do the same thing, but the new time. So when they come back to the US, they do US time, morning and evening dosing of that. So big fan of VIP. VIP has lots of great uses as far as anti-inflammatory benefits. And so we use that in our patients who have mold and Lyme disease state called chronic inflammatory response syndrome. We use it in very teeny tiny itty bitty doses. And then we use it again at the end of their treatment course, helping them to completely recover from all of the damage that was done by this chronic inflammation. And so that's probably where I would go. It depends on what your course is. I always start with hormones because hormones fix a big majority of things. So if you're not doing some sort of hormone replacement therapy, that's where we want to start. Of course, what I really wish for us to take another step back, if you were to come walk in the door to my office, the first things we would do is tell me about your lifestyle, tell me about your toxic exposures, tell me about your diet, tell me about your dental health, tell me about your sleep habits. Tell me how much time you spend with social media and television. Just what is your social life like? Tell me about what's your purpose and passion in life, because all of those things are going to contribute. And a peptide can't overcome a poor diet, no lack of exercise,
right.
Poor lifestyle choices, drinking too much alcohol, social situations that are toxic to you, environmental toxins that we intentionally or unintentionally get exposed to. And so those things all need to be cleaned up in order for these peptides to do their work.
Great advice. Great advice. I'm so excited about this whole podcast. We've been talking a little over an hour. And so if my listeners would like to reach out to you via social media or actually possibly even work with you as a new patient, where can we find you?
So I'm on Instagram at Dr. S. Ferree, DRSFERREE. And I'm on, I have a Facebook page, and then our website is Vine, as in grapevine, medical.com. You can reach out to their phone numbers there, or our info, you can do a contact us kind of thing on there. We see membership clients where we treat the whole entire client, or we see individual purpose things. So if you just have a tendon or joint injury that's not recovering, we'll see you just for that. If you want to do weight loss, if you want to do just a longevity package, we have those kind of packages where you can see us just for that slim purpose, or you can see us for the entire thing, for everything.
That's awesome. And you're in Alpharetta, Georgia, correct?
Exactly. It's just north of Atlanta.
Okay. And also, too, I wanted to mention really quickly, one of my favorite skincare lines, which I'm using right now, is called Vitali, and you are associated with Vitali. So let's talk about their skincare line real quick. And you know what, while we're doing that, I meant to ask you about copper peptides. So this maybe might tie everything in.
It's perfect. So GHKCU is a bioregulator peptide. The reason we love GHK is twofold. One is because it holds on to copper and releases it to be used by collagen. Woohoo, that's what we want. Because if we need copper as a cofactor to help collagen do its job and be the right kind of collagen to go in our face exactly, or in our skin all over, in our bodies, everywhere we need collagen to help with them to be functioning optimally and more youthfully. So it not only causes you to release the copper for that side effect, but GHK itself will get into your cell, into your nucleus, and tell your cells to express this cell as more youthful. So it up and down regulates the DNA. So the DNA, it has hundreds of genes that it affects, and it will turn up some of the DNA and it will turn down some of your DNA based on how your body is expressing itself youthfully. So you'll be more youthful. Your stem cells will be more stem-like. And when we do compare it to using things like retinol, vitamin C, it is more effective than those on skin. Now I'll use all of them. I'm using retinol and vitamin C and all the things because I'm going to do it all. I'm sure the same way. But I really love the Vitality skincare line. I would not recommend it if I wasn't a user myself. I use the serum and the eye cream and the moisturizer every day. I love their skincare products. And they are doing a discount code for your clients today. If they go to vitalityskincare.com and they use discount code Dr. S, DRS, they'll get 20% off their order.
Woohoo! Oh, and everybody who's listening, I'm telling you, it's one of the best skincare lines I have ever used. I use the same thing that Dr. Suzanne uses. I use the serum, I use the eye cream, and I use the moisturizer. And I couldn't be happier. It's really top of the line. So thank you so much for the discount. That's so awesome.
Yes, of course, my pleasure.
Well, Dr. Suzanne, this has been so informative. I can't wait to go back and re-listen and fine-tune my notes. And I can't wait for, I've been a big fan of yours for quite some time, and I've listened to you on other podcasts too. So to have you join me today and share your knowledge, especially with all my listeners, mainly over the age of 50, it's really been enlightening and could be life-changing for some.
Yes, thank you so much. I would love if anybody has a chance to get my book. It's out counterclockwise.
Thank you. I have it here in my notes. I mean, yes, let's talk about your book. It's called Counterclockwise.
Yes, and it's approachable for patients, but it's also if you have an interest in using peptides, but your doctor doesn't know anything about them, this is a really approachable book for someone who's new to peptides. It's designed to be read by clients, however. So this is all the information in a way that I would normally present it to my clients. And most of my clients are pretty smart, so I figure that it's readable by most people. There's pieces of it that are deeper dives that give you a lot more science if you want to read that, but you can skip over the deep dives and just read the stories of people having successes and pass it on to your own doctor if you want to have them read it and get a reference book. It's pretty simple to read, but there is some science in there that's helpful for doctors too.
That's awesome. And you can get this, I know, on Amazon, correct?
Yes. I'm working on the audio book. It's coming out. I've got about probably 20 more hours to record.
Oh, that's fantastic. Thank you for bringing that up because I had it here in my notes and for some reason I just forgot to bring it up.
Thank you.
It's been a wonderful conversation. Thank you again for being so informative and sharing all your valuable knowledge.
Thank you so much, Helen. It was really a pleasure to meet you.
Thank you so much. Take care.
I sure hope you enjoyed this conversation with Dr. Ferree. So much valuable information. I hope you guys were all taking notes. Oh, the world of peptides. Now, what exactly are peptides? Peptides are short chains of amino acids linked by peptide bonds, essential for fundamental processes within the body. Peptides have been used in medicine for about 100 years, yet it seems like just now they have become a frontrunner. Peptides are making waves in the modern medicine and wellness industries, from reversing the signs of aging to tackling health concerns. We're yet to discover their scope, but what we do know now is quite promising. And whether you're acquainted with peptides or learning about them for the first time now, peptides should definitely be on your radar. They are the next big thing in healing, and their diversity is a major part of their capabilities. Now, peptides are naturally occurring in the body, yet as we increase in age, these peptides decrease and deplete. Peptides come in oral supplements and in injectables, and they provide pro-aging support, anti-inflammatory, and muscle-building properties. Recent research indicates that some types of peptides could have a very beneficial role in slowing down the aging process, reducing inflammation, helping with weight loss, healing injuries, and so much more. Dr. Ferree gave us such great information on a variety of peptides used for various health concerns. If you have a health concern, there's probably a peptide out there to help you with it. If you would like to learn more about peptides, you can buy Dr. Suzanne's book called Counterclockwise, and you can find that on Amazon. If you would like to reach out to Dr. Suzanne and her team at Vine Medical, you can go to www.vinemedical.com. She's also on Instagram at Dr. S. Ferree, and that's Ferree, and she's on Facebook at Suzanne Jeanette Ferree. You can reach me at www.ageisirrelevant.com or helen@ageisirrelevant.com. If you like this episode or you like any of my other episodes, please share. And if you have a chance, if you could go to iTunes and leave a review, that would be amazing. As always, it's great to catch up with everyone, and I'm so happy that I'm able to have such guests, such great guests like Dr. Ferree, to share her wealth of knowledge with my listeners. And until next time, age truly is irrelevant. Bye-bye.